George Zimmerman and the medication factor filed under Casey Anthony, George Zimmerman, Injustice, Murdered Children, The Jade Mission, Trayvon Martin. 212 comments July 4, 2012. As most are sitting anxiously in wait for Trayvon Martin's final toxicology report, I've had time to do a bit of research into the medications that George Zimmerman admitted to having been prescribed from various documents released. George Zimmerman admitted to having been diagnosed as a child with ADHD when interviewed by homicide detective Chris Serino. He admitted taking Adderall for this condition. Adderall is also listed in his recently released medical report dated February 27, 2012. *C released medical report dated February 27, 2012. For complete reporting sources. Although the copy is of poor quality, it shows Zimmerman on February 13, 2012 was given a written prescription for 60 Adderall, 20 mg tablets, to be taken by mouth, 1 tablet twice a day. List of medications from George Zimmerman's medical report. Active medications. Date. Drug and dosage thiazide refill note 02127 2012 iodine 400 mg tablet 61 tablet polmidopropane 02R13 2012 lateral 20 mg tablet 61 1 ABLET polmidoritten RX give P1123T2012 EMAS from 30 mg capsule 91 capsule hard soft 0 TC POHSP 1123 2012 Omeprazole Rive 40 mg 31 capsule delayed release 3 RN Capsule iron player coded PO daily December 29, 2011 Brax 91 capsule hard soft 3 leto Potipedi active ADLC add-ons PVX ISTLA drug and dosage polartin GBVS alucosamine convertant TP1 tablet PO daily multiple vitamin tablet 1 tablet PO daily omeprazole Rive 40 meter G capsule capsute Delavate release anterior coded PO UV from 30 mg capsule 1 capsule hard soft etc. POHS Asterisk on page 181, in the discovery documents, George Zimmerman reported to EMT paramedic Michael Brandy that he's prescribed Librax and Tamiflu, SP. What is Librax? Chlornespoxide HCl bromide capsules. Librax is prescribed to control emotional and somatic factors in gastrointestinal disorders. Chlornespoxide hydrochloride is a versatile, therapeutic agent of proven value for the relief of anxiety and tension. It is indicated when anxiety, tension or apprehension are significant components of the clinical profile. It is among the safer of the effective psychopharmacologic compounds. What is temazepam? Restoril, trademark. Temazepam is indicated for the short-term treatment of insomnia, generally 7 to 10 days. For patients with short-term insomnia, instructions in the prescription should indicate that Restoril, trademark. Temazepam should be used for short periods of time, 7 to 10 days. The clinical trials performed in support of efficacy were 2 weeks in duration with the final formal assessment of sleep latency performed at the end of treatment. What are the precautions when taking temazepam? Restoril. Before taking temazepam, tell your doctor or pharmacist if you are allergic to it, or to other benzodiazepines, e.g., lorazepam, diazepam, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Note asterisk Librax and Restoril are both benzodiazepine family. According to George Zimmerman's medical report, he takes Librax 3 times a day and Restoril once at bedtime. Lodine 400 mg is a non-steroidal NSAID and doesn't apply to my article because it was newly prescribed the day of his doctor visit February 27th. What is Adderall? Adderall, amphetamine and dextroamphetamine, is a central nervous system stimulant. It affects chemicals in the brain and nerves that contribute to hyperactivity and impulse control. Adderall is used to treat narcolepsy and attention deficit hyperactivity disorder, ADHD. Adderall may also be used for other purposes not listed in this medication guide. According to Wikipedia, Adderall is a Schedule II drug SNP. Like other stimulant drugs, such as methamphetamine and cocaine, Adderall directly affects the mesolimbic reward pathway in the brain. Amphetamine salts preparations are considered to have high abuse potential, and it is classified as Schedule II by the USDA. With the Safe Streets and Communities Act in Canada, Adderall has been reclassified from Schedule III to Schedule I. USDA Schedule II controlled substances. Substances in this schedule have a high potential for abuse which may lead to severe psychological or physical dependence. Examples of single-entity Schedule II narcotics include morphine and opium. Other Schedule II narcotic substances and their common name brand products include hydromorphone, dilaudid, registered mark, methadone, dolafine, registered mark, meperidine, demerol, registered mark, oxycodone, oxycontin, registered mark, and fentanyl, sublimase, registered mark, or duragesic, registered mark. Examples of Schedule II stimulants include amphetamine, dexedrine, registered mark, Adderall, registered mark, methamphetamine, disoxin, registered mark, and methylphenidate, Ritalin, registered mark. Other Schedule II substances include cocaine, ammobarbital, glutamide, and pentobarbital. No asterisk considering the fact that Adderall is indicated for the treatment of ADHD and narcolepsy, which seems to be the case for George Zimmerman. I don't believe he's being improperly prescribed these three medications, but there's always a chance for abuse, which remains to be seen. After having listened to his call to non-emergency 911 several times, I can hear a definite slur in his speech pattern as he speaks to the dispatcher as compared to the sound of his voice in other recordings. There's also a muffled sound which could indicate he was impaired in some way. From the list of medications, any two of these could account for his droll, almost zombie-like reaction to what was taking place at the time of the 911 call. As an example, during the time when it's believed the suspicious person is within 1 car length from his person encircling his vehicle, it seems he isn't able to comprehend imminent danger. Surprisingly, he doesn't mention this to the dispatcher either, which is why I'm questioning his mental state. Was he impaired? Unfortunately for him and for the jurors, they will never know because George Zimmerman refused to be taken to the hospital on the night of the shooting. Though it was reported he was bleeding profusely from several abrasions and visibly 1.5 on the back of his head from allegedly being pounded on the pavement by Trayvon Martin. Had Zimmerman agreed to go to the hospital for his injuries, it's possible this could have strengthened and supported his case, but at the same time, there's a strong possibility an astute ER nurse would have suggested a blood test, considering this could surely become a life-or-death criminal matter. A toxicology report would indicate levels of his prescribed medications and alcohol level if he had done any social drinking that day. Or perhaps George Zimmerman's knowledge of criminal law persuaded him to refuse medical treatment. That's also a possibility. As I'm trying so desperately to understand George Zimmerman's actions and lack of common sense on the night of February 26, 2012, I began to wonder how did a simple phone call to report a suspicious person to an emergency 911 go from normal behavior to impulsive and irrational actions. For an uneducated person, 28 years of age, to jump out of his vehicle in an impulse in order to follow a person he had just described to the 911 dispatcher as possibly being high on drugs and possibly carrying a weapon in his waistband, goes beyond my realm of reason. I thought it might be helpful to learn a bit more about his mental disorder, ADHD. ADHD, Attention Deficit Hyperactivity Disorder. What is ADHD? In short, as defined by WebMD.com, children with ADHD, which is when George Zimmerman was diagnosed, generally have problems paying attention or concentrating. They can't seem to follow directions and are easily bored or frustrated with tasks. They also tend to move constantly and are impulsive, not stopping to think before they act. These behaviors are generally common in children, but they occur more often than usual and are more severe in a child with ADHD. The behaviors that are common with ADHD interfere with a child's ability to function at school and at home. Adults with ADHD may have difficulty with time management, organizational skills, goal setting, and employment. They also have problems with relationships, self-esteem, and addictions. Applying just these two paragraphs defines the person I perceive as George Zimmerman, the shooter of Trayvon Martin, a 17-year-old teen who happened to visit his father and his fiancée at the retreat at Twin Lakes condominiums. Trayvon was stranger to this area, during a time when George Zimmerman was crowned neighborhood watch captain. Being hero of the town, George had a lot on his plate which may have been overwhelming for a person with ADHD. Add a stimulant such as Adderall to the chaos and confusion of that night to George's false sense of confidence, and also perceived good common sense. Since defense attorney Mark Goldmacher seems to be on a fishing expedition, perhaps he'll consider using ADHD and the medication factor as a defense. Just my opinion. Happy Independence Day. The JB Mission Services. http://www.gzlegalcsc.com/Zimmerman Medical Report. http://184.170.111.159/George Zimmerman Docs Documents. Zimmerman_bond_hearing_exhibits/George_Zimmerman_medical_medical_report.pdf. http://www.rxlist.com/librax.rug.htm. http://health-stuff.com/2010/01//long-term-term-effects-of-Adderall/ http://en.wikipedia.org/wiki/Adderall. http://www.bugs.com/Adderall.html. Canadian Schedule I drugs. http://laws-lewis.justice.gc.ca/ang/acts/c-38.8/ Page dash 23.html hash h dash 26 USDA schedule 2 drugs http://www.ddiversion.usdoj.gov/schedules/index.html http://www.webmd.com /ad/ADHD/guide/attention-deficit-hyperactivity-disorder-ADHD related homozygote Trixin